Anti-government protesters gathered at the Victory Monument this afternoon with plans to march to the Prime Minister's residence to demand Prayut Chan-o-cha to resign for his mismanagement of the pandemic. Clashes occurred between the crowd control police and the protesters, where protesters threw projectiles, prompting police to use tear gas and rubber bullets. Firecracker-like and gunshot-like sounds have also been heard. Meanwhile, the Thai police claim that their use of enhanced crowd control measures, including water cannons, tear gas, and rubber bullets during yesterday's protest in Bangkok was necessary and in line with standard practices because hardcore elements among the protesters turned violent. The Metropolitan Police Bureau Chief Police Lieutenant General Pakapong Phongpetra said today that a police investigation into the violent clashes between the protesters and crowd control police is underway. One police officer was shot in the leg and 8 other officers were injured by explosives and other objects hurled at them during the protest. Charges will include violation of the emergency decree's gathering ban, arson, and physical assault of police. The protest called on the government to bring the COVID-19 pandemic under control, solve economic problems stemming from the spread of the virus and government's containment measures, revoke the existing constitution, which was drafted by the previous military regime, and reform the military, courts, and the monarchy. Deputy Commissioner of the Metropolitan Police Bureau, Police Major General Piyat Tawichai, insisted that those who cause damage will be punished and charged with other offenses, such as illegal public assembly of more than 10 people and physical assault of police officers. He also mentioned the civil court's order regarding the use of rubber bullets and tear gas, which did not forbid the use of such weapons, but required police to be more careful. However, some videos circulated online have shown that some officers engaged in kicking those in the protest and hitting at least one occupied car. Regarding the use of firecrackers during the protests, he said that the police already know where such items are being produced and they're being investigated. So far, police have confiscated 122 motorcycles in relation to the protests. Public Health Minister Anutin Chanwiragun announced that 10 million more doses of Pfizer vaccine are being ordered, bringing the total to 30 million for delivery in the last quarter. This comes after the manufacturer informed the Thai side that another 10 million doses can be allocated. He also mentioned that the U.S. government will donate another 1 million doses to Thailand, which is expected to be Pfizer vaccines. Meanwhile, former Pheu Thai MP Dr. Thosapon Serirat submitted a petition to the Public Health Minister demanding full disclosure of the distribution of the 1.5 million doses of Pfizer vaccine donated to Thailand by the United States. He told the media that he has received complaints from several frontline medics and others who are involved in caring for COVID-19 patients and in the disposal of disease-infected waste, expressing doubts about the vaccine distribution. He also mentioned that several people who are not frontline medics and are not supposed to receive the vaccine have been vaccinated. Dr. Thosapon also claimed that the 40,000 doses of Pfizer vaccine reserved for students and expats who want to travel abroad are not necessary because the vaccine is meant for frontline medics, foreigners residing in Thailand, and people in frail health. Anutin later said that the ministry has distributed the vaccine to make sure that every frontline medic is inoculated without discrimination, as he assured that there is no special vaccine quota for VIP or privileged groups. So far, Thailand has administered over 324,000 Pfizer third booster shots out of a total of 21 million doses administered. Regarding the Pfizer vaccine distribution, there is widespread concern among Thais that so-called VVIPs will get the jabs before those who seriously need them. The hashtag #WhereIsPfizer vaccine began top trending on Twitter since Monday after several hospitals complained they had been allocated far fewer Pfizer shots than they had requested. Top medical professionals representing Thailand's main medical organizations urged the government to develop ways to protect medical personnel involved in the care of COVID-19 patients from legal exposure in case of errors in the honest performance of their duties. The call for government action is contained in a joint statement issued by executives of the Ministry of Public Health, the National Vaccine Institute, the National Institute for Emergency Medicine, the Government Pharmaceutical Organization, the Medical Council of Thailand, the Health Systems Research Institute, Thailand Nursing and Midwifery Council, the Thai Dental Council Thailand, the Medical Association of Thailand, and the Medical Technology Council. The statement was read this afternoon by Public Health Permanent Secretary Dr. Kietiphum Wongrachit before the media and in the presence of representatives from the medical organizations. It said that in the past 2 years, all available resources, both human and material, have been mobilized to contain the virus and to procure medication and vaccines with which to treat patients. Due to the limitations of resources and knowledge about the disease and the fact that medical personnel have been working in emergency situations which require quick decisions, the statement said that errors may occur in the course of the honest performance of duties. They urged the government to take action to protect the medical personnel and related experts so that they can do their jobs without fear of legal exposure. Last week, Public Health Minister Anutin Chanvirakul said the government will issue a decree to limit the legal liability of medics involved in caring for COVID-19 patients and in other aspects of efforts to contain the virus. However, he said the law will only cover errors which occur as a result of actions taken in good faith, not gross negligence.